Really? Yeah, we should see what you can do with that.
All right. Let's go to the last talk of this workshop by Ludovica, talking about using race in the explanation of racial disparities in health. You're all yours.
Yes, thank you. Thank you very much for inviting me here. So yeah, this is my talk. I'm talking about using race in the explanation of racial disparities in health in the context of the United States. So in the United States, there are profound biological differences between racial groups. And so age-adjusted death rates from several diseases like diabetes, septicemia, kidney disease, hypertension, and hypertensive renal disease have been shown to be all more than 2 times higher among Black people than among white people. And also cardiovascular diseases and many forms of cancer show analogous patterns. Moreover, racially different microbiotas exist between different racial groups. And epigenetic effects, among other effects which are related to phenotypic plasticity, are able to produce a phenotypic variation between racial groups. So whatever is our position about the reality of race, it is a fact that there are biological differences between racial groups in racialized societies like the US society. So the question is, how do we explain this data? So here are reported the main uses of race in the explanation of health inequalities. So race can be used as a proxy for ancestry-related genetic characteristics that may be involved in causing a risk of complex diseases and affecting people's health, or as a proxy for environmental, social, economic factors that may affect people's health, and or as a proxy for experiences of racist discrimination that may affect people's health. So these different uses of race may be linked to different metaphysical positions about race. So what is the metaphysical position about race that better explains epidemiological data? And do epidemiological data make some metaphysical positions more plausible than others? So about the metaphysical positions about race, we have genetic realism, according to which races exist as genetic entities characterized by some kinds of ancestry-specific genetic properties. Genetic anti-realism, so races do not exist as genetic entities in the sense that there are no racial groups characterized by some kinds of ancestry-specific genetic properties. And then a social realism, where races exist as social entities for a population to be thought of, believed, identified, and self-identified as a race within a social community makes that population actually a socially existing race. And the social anti-realism, there are no races, there are only racialized populations, which are populations thought to be or treated as races. So the genetic realist will explain health differences between racial groups by appealing to some genetic differences among them. But several epistemological issues make this use of race not justified in scientific research. So here I reported some claims by some famous geneticists who use race in their everyday research within the genetic hypothesis in the explanation of racial differences in health disparities. So we have Burchard and colleagues. There's medically relevant genetic differences among human continental populations. And then Borrell and colleagues, 2021. Race is also directly associated with genetic ancestry and therefore indirectly related to genetic variants that may affect disease and health outcomes. And finally, David Reich, who says that as a geneticist, I also know that it's simply no longer possible to ignore average genetic differences among races. And actually, David Reich goes a bit farther with genetic realism of races because he also thinks that there are genetic differences between races that may cause differences in behavior and cognition. So when we talk about the genetic hypothesis, there are three assumptions the genetic hypothesis relies on. The first assumption, race self-identification is highly correlated with membership to a specific human continental population and therefore to a specific genetic ancestry. Second, a genetic ancestry can be unambiguously determined. And third, a genetic ancestry correlates strongly with hypothetical genetic variants that contribute to the risk of complex diseases. I'm contesting these three assumptions. So first, I'm saying that self-identified race is not a good proxy for a specific genetic ancestry. Second, genetic ancestry cannot be unambiguously identified. And third, a specific genetic ancestry is not a good proxy for unknown genetic variants contributing to the risks of complex disease. So contesting the first assumption, we may say that self-identification in any race is not a reliable proxy for genetic ancestry because it strongly depends upon several kinds of psychological, cultural, socioeconomic factors, and also upon personal opinions about what race is, how central racial identity should be in people's lives, socioeconomic status, perceived racial discrimination, neighborhood, and so on. And also it is contingent upon the particular list of admissible races from which a person is asked to choose. So moreover, people even often change their self-identification to a specific race during their life course. So strong is the cultural association between a racial label and specific socioeconomic features that people often modify their racial self-identification in function of their more recent socioeconomic status. So what about the second assumption? So genetic ancestors cannot be correctly and unambiguously identified. The statistical approaches, so the statistical methodologies that are used to estimate ancestry treat our species as if it were populated by people who either are members of discrete populations or are admixed descendants of such populations. But human population genetics tells us that there are no such things as pure and distinct ancestral populations, and even the choice of the populations considered to be proxies for ancestral populations is partly arbitrary. So each attribution to a specific of a specific genetic ancestry to an individual is in itself ambiguous. So following Baker, this human population geneticist and colleagues, genetic ancestries like races cannot be univocally identified. In fact, ancestries, along with ancestry-specific allele frequencies, vary in time. So being defined by DNA, ancestries are subject to evolutionary change. So, for instance, ancestries are subject to birth death cycles, and ancestry-specific allele frequencies can change over time. Ancestries are related through a phylogeny, which describes ancestral and descendant relationships. And as such, it is appropriate to ask how many ancestries existed at a specific period of time and what the ancestry-specific allele frequencies were at that time. So almost no samples are ancestrally homogeneous. So taken together, all these findings indicate that ancestries should not be thought as types. And also, ethno-linguistic group, so race, ethnicity, all carry ancestral heterogeneity, meaning that ancestry classifies ethno-linguistic group as well as continent and race. So using this criteria to group people into genetic categories always leads to misclassification. And for similar reasons, I contest the third assumption, because there is no guarantee that when you build up as a genetic structure of Homo sapiens through a specific method and by using a specific genetic sample, so you cannot, there is no guarantee that you can use those genetic traits on which you have built the structure to predict variation in other traits, because genetic traits are actually not generally correlated in their variation. So continental genetic ancestry serves as a poor indicator of disease risk. And this use of it is due to, according to Sardegna colleagues, to a harmful and superficial interpretation of population genetics. So for this, so for all these reasons, so these three assumptions are very problematic, and the genetic hypothesis is strongly undermined. But so let's say where also the genetic realism can be hidden. I mean, genetic realism also is hidden in the race correction in clinical algorithms. So Bias and colleagues in 2020 claim that one subtle insertion of race into medicine involves diagnostic algorithms and practice guidelines that adjust or correct their outputs on the basis of a patient's race or ethnicity. Physicians use these algorithms to individualize risk assessment and guide clinical decisions. By embedding race into the basic data and decisions of healthcare, these algorithms propagate race-based medicine. Many of these race-adjusted algorithms guide decisions in ways that they may direct more attention or resources to white patients than to members of racial and ethnic minorities. So yesterday, Azita told us about the EGFR for Black people, so I'm not going through this slide, okay? But another example of risk correction is a heart failure risk score, which categorizes all Black patients as being at lower risk. The American Heart Association does not provide a rationale for this adjustment. So clinicians are just advised to use this risk score to guide decisions about referral to cardiology and allocation of healthcare resources. So because Black is equated with lower risk, following the guidelines could direct care away from Black patients. So race correction acts as a barrier to healthcare for Black people. So also race correction in clinical algorithms hides an insidious biological, genetic, typological conception of race that reinforces a racialized clinical practice based on a discriminatory managing of the whole diagnostic, therapeutic, and prevention process by the physician. The patient's fatalism due to this practice may also cause a diminished trust in the doctor, in the therapy, and a minor level of compliance with, of course, negative effects on health. So Bias and colleagues also say that we have to be cautious. We need precaution with risk correction. So when developing or applying clinical algorithms, physicians should ask 3 questions. So the first one And this is related to what you were saying before, right? So is the need for race correction based on robust evidence and statistical analysis? Is there a plausible causal mechanism for the racial difference that justifies the race correction? And finally, would implementing this race correction at the very end relieve or exacerbate health inequalities? So we may consider the possibility of adopting a race-conscious approach to the use of race in clinical practice, so in diagnostic, therapeutic, preventive processes, according to which we don't lose information about an increased risk of diseases and health outcomes in some racial groups, the example of preterm birth before. But we have to reject the genetic realism and the stereotypical and typological view of race hidden in the race correction practice. So also, the genetic realism is hidden behind some kind of explanation of racial differences in sport-related traumatic brain injury. These are all some examples. I mean, there are more examples. So recent studies, for example, focus on racial genetic difference in concussion recovery and neurobehavioral outcomes after concussion between white and black athletes. And they hypothesize that the effect of exposure to repetitive head impacts on neurological disorders is modified by genetic factors that are associated with race. So another example, very similar to an example of race correction in clinical algorithms, is the example of race norming. And race norming assumes a lower level of cognitive function in Black football players. And this norming was used in cognitive tests, making harder for retired Black players to qualify for compensation that the NFL in 2013 agreed to give to retired athletes who received the diagnosis of brain injuries and cognitive disorders like dementia due to concussion. So how it works, this race norming? To determine cognitive impairment, neuropsychologists compare a patient's test performance to their estimated baseline cognitive abilities. These estimations are derived from the test performance of a healthy individual. So this is like the normative standard. Normative standards adjust for demographic factors known to be related to the performance, so like age, sex, and education. But according to their race norming, race was considered as one of these demographic factors influencing baseline cognitive abilities. And the test was adjusted for race under the assumption that Black players possess a lower level of cognitive function than the average white player. So fortunately, this story ended well because, I mean, there was a lawsuit. So after this lawsuit in 2021, the NFL agreed to remove the race norming from the cognitive test. And so also the retired Black athletes could, have this compensation. So far, I tried to show that we need to reject genetic realism and so embrace genetic anti-realism consequently. But what about the social realism versus anti-realism issue? Are there good reasons to be social realist about race? Or should we embrace social anti-realism and definitely so embrace a radical anti-realism about race? Can the need to explain biological differences between racial groups in racialized societies like the US societies help us to make this choice? So, as Ockman has argued, we should think not in terms of socially constructed races with particular kinds of properties, but rather in terms of racialized populations. So according to him and to social anti-realists, populations, there are only racialized populations that are populations thought to be or treated as races. But are we sure that a social anti-realist about race can deal with epidemiological data? So in principle, anti-realists about race should explain the epidemiological data we have seen before by saying that racial differences in complex disease rates are only apparently dependent on race and racism, but are actually due to some other factor, which of course is correlated with race, such, for instance, socioeconomic status constructed as including a sufficient number of indicators. Such a radical anti-realist strategy, however, seems doomed to unsuccess. Why? Because empirical research shows very clearly that although different indicators of success do capture different aspects by which social and economical position affects health, observed epidemiological differences do not vanish away when adjusted for these indicators. So there is an ineliminable residual racial effect that survives. Because of that, few anti-realists nowadays would assume that to deny both the biological and the social reality of race entails the necessity to explain racial differences in complex disease rates just by appealing to sex. Many scholars who have recently held an anti-realist position about both genetic and social race have resorted to the harmful effect of racism on the human body to explain epidemiological data. But the question is, can they do that? I mean, we know that racialization, of course, produces important biological effects on racialized people and therefore produces biologically relevant differences between racialized populations. And these scholars hold that blank anti-realism about race is perfectly compatible with the availability of an explanation of the epidemiological differences between races, which appeals to racism. So Adam Hochman, for instance, again, strongly agrees that racism can affect the biology of racialized groups, but he refuses to subscribe to the statement that race becomes biology. Because to take races as just as worldviews, according to him, is not sufficient to make them real in any sense. So a preliminary issue, so what we are talking about when we talk about racism to explain epidemiological difference. Of course, maybe you know all that evidence. So contemporary scholarship has established multiple pathways by which racism harms health, involving adverse physical, social, economic exposures, as well as maladaptive coping behaviors and stereotype traits. Health differences can be explained as the effect of systematic racial differences in environmental exposures, as you said before, so which are in turn a product of a variety of causal pathways stemming from differences in socioeconomic factors, which of course are in turn the effect of racism and racial discrimination in contemporary US society. So for example, diet quality, exposure to toxic agents, access to healthcare, risk of infectious disease, residential segregation, housing conditions, educational and occupational segregation. So all these and more than these are obvious mediating factors. But also there are some other pathways and many pathways through which racism may act directly on people's health. So for example, interpersonal racism triggers a cascade of biological processes originating as perceived social exclusion and registering as social pain. Exposure to discrimination increases sympathetic nervous system activation and upregulates the hypothalamic pituitary adrenal axis, the HPA axis, increasing the physiological wear and tear, so causing a high allostatic load, and so elevating the risk of cardiometabolic conditions and other health outcomes. Consequently, the discrimination is associated with morbidities, including low birth weight, preterm birth, hypertension, abdominal obesity, and cardiovascular diseases. So according to stress process models, the consequences of exposure to chronic social stressors, such as racist discrimination, create physiological burdens that are challenging for individuals to bear, leading to declines in health resulting from maladaptive psychological and behavior coping. So also there is a stress process that causes health issues among Black people over all the time, or over all the life course, from the utero to later life. I'm not going through this, but there is all this evidence. So if I'm a blank anti-realist about race, can I consider racism as a cause of those biological differences, given that racial discrimination is based on an idea of race and on racial identities, which are deeply shared by a certain community and structure almost every aspect of the social environment where this community lives? So this is my question. And also, doesn't the evidence I appeal to force me to hold a socially reality position about race? And what about racial self-identifications? Aren't racial identities a problem for a blank anti-realist about race? So my claim is that if I want to consider racism as a cause of those biological differences, I cannot be a radical anti-realist about race, because my ascribing the power to change people's biology to racial discrimination is based on an idea of race and on racial identities, which are deeply shared by a certain community, and they structure almost every aspect of the social environment where the community lives. So the evidence I appeal to forces me to hold a socially realist position about race. So exploring, for example, the concepts of structural racism, racial ideology, racial identity, and how they co-construct each other and shape almost every aspect of people's life in a racialized society, makes difficult, really difficult, to claim that only racialized populations exist. So to invoke a strong, systematic, and structural biology affecting a role for racism in our society entails presupposing that races are such socially pervasive and widely used categories that they are socially real and possess authentic causal powers. In a society characterized by structural racism, race has a social reality, so no matter it may have no biological reality. For racialism and racism to produce different health affecting effects on different human groups, the general human population must be systematically treated in relevantly different group-specific health affecting ways by a sufficiently great number of people, and such group-specific differences in treatment must be patterned along racial lines. And this seems to require, in turn, that race possesses some sufficiently robust form of social reality. So also structural racism is not just a perceived interpersonal racial discrimination, as it deeply structures many different aspects of people's lives, determining several inheritable social and biological differences between populations and reinforcing people's racial identity and racial ideology. So racial identity and self-identification as a certain race precedes, also causes racialization processes and discrimination, as much as racial categorizations emerge as a result of racialization processes and racial discrimination. So as Appia argued, for example, collective identities provide narratives that people can use in shaping their life plans and in telling their life stories. The relation between race and discrimination is complex, cannot be reduced to a simple unidirectional model in which some populations become passively racialized because other populations treat them and think of them as racist. Such a relation is historically produced by a complex history of structural racism and racial narratives that continuously shape racial identities. So, and as Goseby colleagues say here, although the processes from which these disparities arise are multifaceted, they are rooted in the historical legacy of racism that is woven into the fabric of life in the United States. So the United States is a racialized social system of interlinked domains across layers of social organization, supported by practices and behaviors that produce a network of relations at social, political, economic, ideological levels that together shape life chances and health inequities. The experience of being racialized, of being classified as belonging to this or that race, Ockman says, is certainly real. And the experiences of living in a racist society are also real. Okay, yes. But racial identity and self-identification as a certain race are also real and have real consequences. So recent psychological and social studies suggest that, for example, racial centrality is a protecting factor buffering the negative impact of experiences of discrimination on psychological distress. And most of the research on racial discrimination and health has relied on self-reported measures. But evidence, recent evidence suggests that because of well-known cognitive biases, including social desirability, self-reported social desirability, self-reported data are likely to provide an underestimate of actual exposure, leading so to underestimates of the magnitude of the association of racial discrimination with and its impact on adverse health outcomes. According to Kamisha Russell, we should go beyond considering the bioethical harms of racism, which we know acts as a barrier, of course, to health and healthcare, and consider race as a bioethical issue, since the race idea strongly shapes and organizes our worldviews and social relations, and it is ultimately responsible for the continuing attempts by scientists to provide the existence of race scientifically. So racist discrimination and the biological effects of it would not exist without race being socially real. We should accept the fact that we cannot eliminate the concept of race, and above all, the concept of self-identified race from medicine and from epidemiology, if we want to understand the effects of racism. So it would be a mistake deeming race socially unreal just because it is genetically unreal. Racialized biases seem to be so ingrained in Western culture that even Black athletes, such as Olympic multiple medalist Michael Johnson, in a 2002 documentary, was reported to say that slavery has benefited descendants like me. I believe that there is a superior athletic gene in us. So race narratives, as Yagi and Goss said, do not exist in a vacuum, but draw from a deep well of already established assumptions that Black athletic success is the product of little more than genetic predisposed traits. Given that the idea of race and race narratives are still so embedded within the racialized Black community, so social anti-realism about race is simply a false position. as long as people who self-identified as a race strongly believe in this categorization, and this belief shapes almost every aspect of their life and their identity, including their biology, embracing social anti-realism would be simply incorrect. So the anti-realist says that race is like a witchcraft. It is just a category ascribed to people, but it is not real. And to take race just as worldviews is not sufficient to make them real in any sense. So for example, Ockman compares race to astrology and says that astrology, also astrology like race, is an intensely used worldview, but this does not amount to let us say that astrology is real. Okay, but suppose that people start using astrological categories such as Aries and Taurus to treat people differently and unequally distribute wealth and possibilities, and that almost every aspect of our society would be structured along these categories. In this case, astrological categories would be socially real, no matter that astrology as a theory would remain ill-conceived. So according to this way of interpreting the meaning of socially real, invoking racism as an explanation is presupposing a form of social realism about race. So contrary to Ockman, I take it possible to characterize a race as a socially real entity by identifying it via a set of significant, unique, and referring social properties and relations, part of which are a conferred and referring social status, attributed or self-attributed on a false presupposition that there's some other non-referring and mostly non-social, like for example, the athletic gene, properties and relations also characterize that race. So this makes race a full-fledged socially real entity. So to conclude, if we want to adequately explain the epidemiological data, we cannot appeal to genetic realism. We have seen that genetic realism does explain the data. However, it relies on three very problematic assumptions. So genetic realism must be rejected. Once we reject the genetic realism, any explanation of the data doing without racism, so just appealing to sex, seems insufficient. Explaining the data by appealing to racism, however, does require races to be considered socially real. Therefore, to provide an adequate explanation of the epidemiological data, we must drop the metaphysical position of radical anti-realism, and we must be socially realist and genetic anti-realist about race. So just I want to finish with this last slide about what I think are our responsibilities as philosophers in this kind of topic of the explanation of health disparities between races. So as philosophers, I think we have the responsibility to show the wrong uses of race, the ones that are not epistemologically justified. And we have the responsibility also to promote with epistemic and ethical arguments the investigation of complex patterns going from structural racism and racial identity to health outcomes, and the comprehension of all the possible ways in which social construction of race can be biologically framed. In order to fulfill this aim, we cannot deny the reality of social race and eliminate the concept of race from scientific research. Eliminating race has some practical advantages, which are nonetheless overcome by its disadvantages. Because embracing some kind of social realism and consequently maintaining race in our scientific discourse is the most correct stance, even in the view of securing social justice in racialized society. So, thank you.
All right, thank you very much. I think we can continue the discussion up to like 20 minutes and then we get some rest before the main lecture. So if you have any questions, bring it up.
Very interesting. Thank you.
Thank you.
So can you tell me whether I have this straight? That a social constructionist definition of race exists primarily because racism exists. Is that a reasonable statement?
Social constructionism is another way to say social realism about race.
Well, right,
Yeah, I mean, race
but
is socially
essentially,
constructed.
that's the target of a racist.
Right?
That's the target of racism, correct? Would be a socially constructed race. Taxonomy of race.
The target.
If you're racist.
Meaning if your target, if you're a racist or an institution that has racism, your object is that you're discriminating against is a socially constructed taxonomy of race, an individual from a
Yes.
racial group.
Yes.
Okay.
yeah.
Um, I guess that's really an interesting way to think about it because it kind of puts the issue onto racism. So whether racism exists biologically or socially, et cetera, and does it necessarily mean that they're correctly identifying race? Or could they just be mistaken and have a certain psychological essentialism that doesn't necessarily reflect even a socially defined race? Does that make sense?
Yeah, I mean, what I want to say is that if you have, and I'm talking about the context of the United States, where there is a very, very deep structural racism. So because
I'm aware.
Yeah.
Yes.
okay, yeah. So I think you cannot, the structural racism makes, I mean, race is a social reality.
Right.
Because, it basically structures every aspect, social, political, institutional aspects of the life of people living in that context in which there is this structural racism. So you cannot deny that in that context, particular context, races do not exist as a social realities. Okay, but for example, in Italy, we may say that we don't have this structural racism. So the discourse would be different in Italy.
Yeah.
So all this discussion, all this, would be different because we don't have structural racism. We don't have a racism that really structures every aspect of of our society. So I would think that in Italy we can talk about racialized populations. In Italy.
Yeah, I guess I was framing it though. The message I was getting is that we may be putting our focus in the wrong direction when we discuss the metaphysics of race. You know, we may want to focus on racism as a phenomenology issue or a psychology issue, and less so on groups of race, because they could mistakenly be essentializing race, and that wouldn't necessarily make an argument for the existence of race either through a social construction or a biologic argument.
I'm not sure I can get your question. Okay. Yeah.
Maybe we can talk after.
Yeah.
Because I think it's really an interesting, it may move the needle to trying to identify that racism exists and how it exists and more of a metaphysical.
Yeah, I mean, I'm just comparing the different metaphysical positions within the context of the explanation of health differences between racial groups, right?
Yeah.
So this is what I try to show, that genetic realism doesn't work, okay? And we reject it.
Right.
But social anti-realism doesn't work as well. So we should embrace social realism about race. So we should not be just, we should not reject race completely, you know, eliminate race from scientific research, scientific practice, because it is useful, race. But if you hold a social
Right.
realism about race.
But if racism didn't exist,
Racism
would
does
race exist?
racist, yes, social
If
racism.
racism didn't exist,
No. Social racism exists.
even if racism didn't exist,
No. No,
Okay.
it's the structural racism that make races socially real.
Well, no, just thanks. Just on that point, it's a really, really interesting talk. Thank you.
Thank you.
Yeah, just on that point, I mean, it seems that races play or you know, race identification, self-identification with a particular racial group plays a really important role in people's understanding of their own identities and communities, in how people's lives are structured and organized, partly independently, you know, they're causally linked to, but nowadays partly independently of the existence of racial oppression. And so I do think, I know this is, you know, it's a debate that's had in the literature, but I do think that you're missing something if you were to say that there is no race, because for lots of people, their race is meaningful to them, and to say that their race is meaningful to them only insofar as that is a way of talking about the ways in which they are oppressed is, I think, mistaken. So
No,
I
I think-
yeah, I'm worried. I'm wondering if you think that we can really make sense of those kinds of cultural strong sense of identity without, or sort of linking race to oppression in another way, or somehow some other way of doing that.
Of course, I consider that, I mean, racial identities can be taken as something independent of a structural racism. But as I said, they really, I mean, they really co-construct each other. They shape each other. I mean, there is a long history of racial, structural racism in the United States, in the US society. So I think it's not so easy to say, okay, but there were racial identities before the racism started to be so to be so strong and deep to structure every aspect of the society. I think the two things, like, they were like
So I agree.
co-evolved together.
Absolutely, but that doesn't entail that were there to be a, you know, relevant diminution of racial oppression, that would mean that the kind of the identities themselves would go away, or the existence of races would disappear as a consequence. I agree they co-evolved.
Mhm.
Absolutely.
Okay.
But, you know.
Yeah, sorry. I think that, okay, this is how everything was started to be. So looking at the past and the present, but I think in the future, the racial identities would remain, even if we removed racism. Yeah, I think so.
But race didn't really exist until the 1600s. For what we're talking about. No, I'm going to insist. No, okay. Okay.
Okay, so I'm so sorry I missed some of that, trying to like take care of situations, but that was very interesting where I had to leave it, and I hope to catch the rest of it. So this, in part, by saying I may have missed, but I did miss some of what you were saying towards the end. But picking up on this question, one thing that was really interesting me before I had to step out, that ties to this entire conversation, is that it seems increasingly important to at least suggest that race, and I'm acknowledging your question, Jim, has just got to be seen as something that we can legitimately, propose functions outside your proverbial Kantian sort of a priori and a posteriori. So at the moment we insist that there has to be some kind of way to frame, I'm not even saying that you are doing this, I'm just saying that where one insists that race has to exist in some kind of epistemological framework, where it's either something derived from experience or something knowable in ways that don't require experience for it to be brokered through and circumscribed by. Is it possible then that one way to address a question, did race exist, is to suggest that the fact that there are different ways to discern phenotypical identity is something that we could probably agree to, which is not the same thing as saying that we must accept something that we have learned since the Enlightenment to call race. And so maybe now part of what I'm asking about is it possible that we have a phenomenon here that necessarily won't domesticate to our current discursive practices of talking about it? And what might that mean for what you are suggesting?
Sorry, can you just repeat the last things you say?
So possibility that the ways we talk about race,
Mhm.
which in part seem to be dependent, I'm suggesting, not insisting, on a priori and a posteriori distinctions. If we imagine that race might be something that does not domesticate to that, then, for example, questions of whether or not race exists separate to racism would kind of be rendered not so important, because what makes the question valid, or what makes the question a question, is a set of presuppositions that I'm suggesting we might question.
Oh. Sorry, I don't think
Okay, maybe it's something to explain on another occasion.
So thank you very much for your talk. We already discussed this issue because like we have very similar and very different opinions on this issue of reality of race. I have just one question. I think it may be super stupid, but I was just thinking about how different beliefs affects people's body, right? So if we take neuroscience and biology seriously, then generally people's cultural environment and social environment, whatever it means, shapes their brain structure and affects their body in the forms of genetic expression, and it's also includes beliefs in things that really don't exist, like a God, right? So people who strongly believe in God, they don't only have some kind of beliefs that are totally disconnected from their bodies, but also their structure of their brain is affected by this idea, right? But that doesn't mean that the God exists itself. It just means the concept has some kind of causal effect on what's happening with them because how they think about it, right? So
Yeah.
I'm still not totally like, I'm still not convinced that by saying that the belief in some concept, like I can believe that I will be, I don't know, a princess in the future, and that will shape.
So you are talking about the slide about the central, how central is the racial identity, or in general? Because
Like generally, because like that generally society
But
structure.
structural racism is not just about beliefs.
Yes,
It's
of
not just
course,
this.
but that we have like a lot of structures that are shaped by peoples that believe in God, right? And a lot of discrimination based on that
Yeah,
belief as well.
but these beliefs don't go to structure all aspects of our society.
Oh, in some societies, they do.
No.
a lot.
I don't think so. It's like the example of astrology. You cannot compare
Not
astrology
necessarily.
of the belief in God with
Um,
race in the United States.
so-
What
so-
there is,
So the difference is that most people don't believe in astrology that much, and
Yeah,
we
and
don't
many
have
people
like
don't
any
believe in
laws.
God as well.
So I live in Poland, so, you know.
Okay, so maybe your context, maybe your context. Yes, right. I think
Because
it's
a lot of
very, it's
laws
very
in our country are
important
structured
to
by that
analyze the
belief in
different
God.
contexts. Maybe in your context, the Polish context,
All the Abrahamic religion, but they can go to.
Oh, thank you.
yes.
But it's not necessarily a causal. Religion itself is not the cause of the.
No, I mean like the beliefs, they like, you know, if you read a lot of like neuroscientific research, like the fact that someone believe in something, it changed their structure of the brain and so on.
And that's behind racism,
So
psychological essentialism, basis and race, etc.
Could I just quickly ask, very gently, you say no structural racism in Italy, so that
yeah, I would say that there is not a structural racism.
I would be
Structural
delighted to know
racism.
how you are understanding structural. How are you defining this word?
Yeah, I mean, I have I don't want to define it. I just have this slide about how it has been defined. So it's interesting.
Gotcha. So nothing in the first bullet point applies in Italy. Is
Sorry?
it? Nothing in the first bullet point applies in Italy?
No, I mean, it's not, I mean, there is racism, of course. There is racism in
Yes,
Italy.
no, but it's structural racism that we're
discrimination.
asking about.
Yeah, yeah.
So you're saying that
this is
there's no,
no
nothing in,
structure, because the structural racism, it's so strong that shapes all the, you know, every aspect of the life of an individual living in that social context, every aspect of the society, the policies. So,
okay, I
you
understand.
know, and we don't have this in
so
Italy.
if an ethno-racially,
Yeah.
if an ethno-racially minoritized person or persons, if we were to survey or however solicit testimony, acquire data from people who are ethno-racially minoritized specifically to Italy,
Mhm.
and ask them, not least on criteria related to how long they have been living in the society,
Mhm.
whether they felt that there was structural racism in Italy, based on their experiences, what is the likelihood that the majority of people would testify in ways that would support your statement at this moment?
Yeah, of course, but you know, also the racial identities in Italy, they're not so. We don't have this. We have a recent migration of people from Africa, from north of Africa,
That
but
has
very recent.
nothing to do with the structural racism identified in your first bullet point, where
So
I'm
we
asking,
didn't have time to have a structural racism yet. Maybe there will be no.
are you genuinely seriously saying this right now?
Sorry?
Are you genuinely seriously saying that there are no people who are ethno-racially minoritized in Italian society who don't experience what we could legitimately characterize in your first bullet point here? Is
Yeah.
that a claim that you want to make?
Yes, because I would be aware of it because of a. Because I think this, you can tell about the structural racism also if you are not the discriminated race. I think so.
Okay, so I think we are closing this back. I think this is a very nice place to stop because there's a lot to thought and a lot of discussion to continue. Let's thank our speaker one more time.
Thank you.
And we look forward to our annual lectureship.
Yeah.